hold it. Go. Go. You're good. Go. Hi, I'm Kristen Holland-Shear with UT Southwestern, and I'm here with Dr. Ildiko Lingve, who is an endocrinologist here at UT Southwestern Medical Center. And today we're going to talk about diabetes. But before we start, I want to take a minute to thank the North Texas chapter of the American Diabetes Association, as well as Parkland, for partnering with us on this very important discussion. So be sure to like the conversation as we move along and ask questions in the comments. We're here to answer whatever questions you may have. And so to get us started off, our first question is, how prevalent is diabetes?
So diabetes is very prevalent nowadays in the United States as well as all over the world. It has almost tripled in its prevalence of how common it is over the last 20 years. Currently, it's estimated that in the United States at least, 1 in 10 people that live in the United States have one or another form of diabetes. The most common form, so 95% of these patients actually have type 2 diabetes. Type 1, it's a lot less common.
And I heard recently that the numbers have been switching, where diabetes, particularly among kids, is growing as well. Could you talk a little bit about that?
That's true, unfortunately. So diabetes goes hand in hand with the obesity epidemic. And we've all seen more and more people that are overweight and obese. It's actually estimated that 2/3 of the US population now is overweight or obese. And the same trend is happening with our kids as well. And more kids have obesity and overweight. And unfortunately, these kids are not immune to diabetes. So they are starting to develop type 2 diabetes some at very young ages, unfortunately. So where our pediatric colleagues used to only treat type 1 diabetes, they never ever had a patient with type 2 diabetes in that age group. It's estimated nowadays about half and half of their patients who have diabetes, so their kids who have diabetes, have type 1 and type 2, which is very scary statistics.
Okay, so you mentioned obesity as one reason. I mean, what are some warning signs people could look for, both in themselves and in their children?
So the first signs of a high blood sugar, which is what diabetes is, are not very specific. So other conditions can also cause these, but it's important to bring these to the attention of the doctor so they can do a few tests and make sure that the right testing is being done. So these could be tiredness, these could be sleepiness during the day, these can be increased thirst, increase in urination, waking up at night to go urinate, increase in appetite, weight loss that's unexpected. All of these blurry vision, they are associated with a high blood sugar. Also for the ladies, frequent yeast infections, or more than the usual number of yeast infections that somebody has, could also be a sign of elevated blood sugar.
And are those are the same in both adults and in children?
That's correct, yes.
Okay. So what are some ways that that you can treat diabetes?
Well, it's very different whether it's type 1 or type 2,
Mm-hmm.
and then it's very different depending on what stage of diabetes it is. Is it just newly diagnosed? Have you had it for 20 years already? What have you tried and not worked? So there's not a one answer fits all. It really depends on the patient, and it really depends not just about their diabetes, but what other medical conditions they have. So there's no easy answer to this question.
All right, so while we're going, I wanted to take a moment again to thank the American Diabetes Association in Parkland. And don't forget to like the conversation. I see the numbers growing of people participating. And ask your questions in the comment. Ask your questions in the comment section. Now, I know Dr. Lingve is involved in research here at UT Southwestern. So what type of research are you working on now?
So yes, we have many different research projects that work on diabetes, obesity, and metabolism at UT Southwestern. These range from very basic science research that look at why people get diabetes, what are the abnormalities underpinning the diabetes, all the way to research that is being done in human patients and most of these involve development of new medications and understanding how different treatment regimens might be helpful in certain populations. In our group, we're doing several clinical trials with new medications that are quite promising for patients with type 1 diabetes as well as type 2 diabetes. And we have several research projects looking at old medications but new strategies for patients with diabetes and really matching that right therapy for the right patient.
Okay. And so with clinical trials, how does somebody, let's see what they're asking, how does somebody get involved in clinical trials?
Wonderful question. I hope lots of people are interested in clinical trials because they're an excellent way to get good diabetes care. Our team is very dedicated to diabetes, so we do a full assessment. We see if somebody qualifies based on their medical history, what medications they're taking, what their numbers are. We see whether they qualify for a certain trial. If they do qualify and continue to follow with us, then we see them at every visit and make adjustments to their medications, make sure that they're doing the right thing, make sure that they're getting the right medications, that their diabetes is under control. And our team, our staff, it's very dedicated to the cause of diabetes. So they like to help patients accomplish their health goals that they have. And we want to say that what we're testing medication-wise, it's very important scientifically. So by participating in the study, you are helping the future generation of diabetes medications and patients with diabetes to get better treatments. But it's most important for the patient who participates because they get to learn about their diabetes. They get to spend more time with the staff and with the doctor and get to learn more about what's the right thing they need to do to control their diabetes. So it's a win-win situation both for the patient as well as for future generation of patients with diabetes.
Right, so are you looking for patients with both type 1 and type 2, or does your group focus on one or the other?
So most of our current studies are for patients with type 2 diabetes, but at any given times we have new studies coming up. So even if we don't have a study at this moment that enrolls a particular type of patients, we keep your name, keep your information, and if you're interested, we can call you when such a study comes up. And the best phone number to call is 214-648-2515.
All right, did you get that? Yeah, go ahead.
648-2515.
Good plug. So are you ever looking for healthy volunteers or maybe people that are in the pre-diabetes stage? So they haven't been diagnosed as full-blown diabetes, but they're kind of inching along that way.
Yes, so we have some obesity studies that we do. So those are for patients who have pre-diabetes or not quite there yet, but they have obesity. And like I said, we keep your name if you don't have something at this moment, but we always get new studies and we can always call when we have something that opens up that fits the characteristics.
So how many do you have going on at any one time?
Right now we have about 10 studies going on.
Awesome. So don't forget to ask your questions in the comments. We're doing really well so far. So what, let's see what this one they're asking about. Let's see. So they're asking about treatments. So what is new on the treatment horizon for type 2 diabetes?
Yes, so type 2 diabetes treatment regimens have had quite an explosion in the last 10 to 20 years. We used to have like 3 or 4 different options. Now we have to the tune of, I lost count, about 45, 50 different agents.
Wow.
And we have 12 different classes of diabetes medications that are approved for type 2 diabetes. So lots of different options. It's a matter of finding the right regimen for the right patient. So the newest medications, the newest classes that are most popular are 2 of them. So one are the bigger class of incretin agents. So these are either DPP-4 inhibitors or SGLT2 agonists. So they're fairly similar, work through a similar mechanism. The first class, the DPP-4 inhibitors, come as a pill. The second class, the GLP-1 agonists, come as an injection, which is either twice a day, once a day, or once a week, depending on which product is being used. They're very helpful because not only they work on insulin secretion, so they improve your own insulin production ability, but they have a very nice side effect, not exactly a side effect, but it's a very nice sort of bonus effect. They work on the brain to tell the brain you're full. So you end up eating less, which is of a lot of help for patients with diabetes, because the less they eat, the better the blood sugar, and the less insulin they need to make to control their blood sugar. So especially the GLP-1 agonists, the ones that I told you they come as a shot, it's a well worth shot because they're very effective both as a diabetes medication but also as a weight loss agent. The second class that's also new, it's the SGLT2 inhibitors. So these are pills that have been around for a few years now. They work on the kidney, so they can be combined with any other medication because they don't work on the classical diabetes pathway. So they purely make sugar being dumped, for a less scientific word, into the urine. So instead of sugar circulating in the body, it gets secreted out in the urine and out in the environment. So you have less sugar in your body. So it's not necessarily addressing the cause of diabetes, but nevertheless, it's a very effective way of getting rid of some extra sugar. So you get better blood sugar levels, you get a little bit of weight loss because you're basically wasting calories down the drain. So also quite popular because they come as a pill, once a day pill, and a lot of patients benefit from them quite a bit.
Absolutely.
So these are the two newest classes that we have, and they've both been quite promising. And interestingly now, both of these classes now have some cardiovascular studies. One agent in each of these classes now have resulted very large cardiovascular studies, meaning patients with heart disease or a stroke were enrolled and tested whether these medicine helped them with that, and both of these were shown to reduce the risk of heart disease. So very promising.
So obviously everybody likes to take a pill. Are there other ways to reduce diabetes without taking medications? Is that even possible? Or is that a definite part of the mix?
It's absolutely the biggest part of the mix. So I like to tell my patients that everything that I do, meaning write prescriptions and you take the prescription and fill them and take your medication, that contributes about 20% to your success. 80% is what you eat and how you live and how you exercise and what are you doing on a day-to-day basis. That's 80%, if not more, of the recipe for success. So just taking the pills without changing anything else in your life, it's not gonna be successful and definitely not long-term. So the best investment for the long-term success from a diabetes standpoint, overall health standpoint, is to change the reason why the disease has progressed to the point of having high blood sugar. So eating differently, adopting a new way of eating and exercising and doing the daily routine.
So let's see, it looks like, so diabetes, so it's not all about sugar. Like people that are they're saying that people with diabetes, they used to say they couldn't eat sugar. That's not the case, right? They couldn't have like candies and sweets.
So it's a little bit different here if we're talking type 1 or type 2. So it's all about quantity is what I tell my patients. A balanced diet is healthy. It's not like you should never ever touch a cake. But think about portion size. If you're gonna have a salad that's very healthy and low calorie, you can probably have a big bowl and not have much of a dent on your blood sugar. If you have a cake in front of you, you take 2 spoons of it and it's probably gonna have about the same impact on your blood sugar as a big bowl of salad. So it's a matter of, you can have anything you want, but how much of it is what it comes down to. So salad, a lot, it's okay. Cake, 1 spoon, 2 spoonfuls. It's
Yeah.
probably as much as you should be having if you have diabetes. Just to
Gotcha.
kind of taste it and enjoy it, but don't eat the full plate of it.
Okay.
For type 1 diabetes, if you're normal weight
Mm-hmm.
and you know how to carb count, how to adjust your insulin properly, that is an option. If you know how to adjust your insulin based on what you're eating,
Mm-hmm.
then you can have your cake and eat it too. And you can have your pizza and eat it too, as long as you've worked with your doctor and you know how to adjust your insulin
Okay.
adequately for it.
Okay. Yeah, it looks, so what is, they're asking about for type 1 diabetes, kind of those new, they've got like devices that you wear around your waist, they didn't actually name it. How does that help, and is that where the future is going
Yeah,
for
so
type 1
we
care?
have so many new gadgets now
Yeah.
that have advanced quite a bit. I mean, the ultimate goal is to create a device that senses the blood sugar, has a very smart algorithm, and then can deliver the exact amount of insulin that you need. And
Mhm.
you don't need to do anything but go about your life in a normal way. So
Right.
that's the ultimate goal. We've made lots of steps in that direction. We're not
Mhm.
quite there, but we're getting closer. We're getting quite close. So the devices that we see now, there are 2 types. One is the sensors,
Mhm.
which measure the blood sugar. So these are some devices that get placed on the under the skin,
Right.
and they measure the blood sugar pretty much, practically speaking, continuously.
Mm-hmm.
They display it on the monitor, and then depending on the device, you have a monitor or you have it on your phone, and you can tell pretty much what your blood sugar is almost every minute of the day. Very helpful, especially in patients with type 1 that have big variations. They can tell whether their sugar's trending down or up,
Mhm.
whether they're having a low. Quite helpful. Problem is they're very, very expensive.
Okay.
The second type of device, it's the meters. So
Mhm.
the insulin pumps.
It's okay.
So
pumps.
these are devices that deliver insulin
Mhm.
at the rate that you're presetting.
Okay.
They're just another way of delivering insulin for patients who need insulin.
Okay.
As far as glucose control, if you're really good about your diabetes, you can probably achieve the same glucose control with the insulin injections that most patients are doing. Having the pump, it's more convenient. It gives you some flexibility when it comes to how you dose it, giving smaller increments of insulin. You're
Okay.
able to do point something units rather than round numbers. So
Gotcha.
it gives you an extra level of flexibility,
Okay.
but it does involve more work, more testing, more money, more resources. It's I like to make the association, it's like driving a car, and is it your choice of driving a Ford Focus, which is just fine, it gets you to work and back and does the job, or do you want to drive a fancy car, some
Maserati.
Lamborghini or Maserati? Okay, it still gets you there. Okay,
Right.
back to work and back, or whatever you
Right.
need to do. One's a little bit fancier, or quite a bit fancier, costs more money. If you're using all those bells and whistles, it's quite helpful. But if you're not using them, then you're probably just as well with the needles, and you can
Gotcha.
do the same thing with the needles if you're doing the right thing.
Gotcha. Okay. Well, I wanted to thank you. Let's see, we've got Mark and Sol and a couple others that have liked our discussion. Please continue to do so, and please continue to ask questions. We've got about 10 minutes left to take questions, so keep them coming. In the meantime, you've talked about a lot of things. How can our audience and people that are going to watch later, how can they support what you're doing here at UT Southwestern or with the various groups that you work with?
So there are many ways. That the best way to support is you most likely have somebody that you know that has diabetes. Help them out. Make sure that they know you're supportive. You know that this is not easy diagnosis to have. It's a lot of work on their behalf. And I know so many times my patients complain that every time they go to see a friend, they just, but please just take this slice of cake. You gotta have just this extra glass of wine or whatever.
Right.
Just help them out. Don't create extra temptation that
Right.
they cannot say no to. Just help them out in that regard. Go out and exercise with them. Acknowledge the hard work that they're doing to stay healthy and do the right thing, and make sure that they continue that, and you help them out with that in every way possible that you can. Make sure they do see the doctor, they do take their medicine, encourage them. A lot of the patients with diabetes who take injections, they're embarrassed to take them in public places because they're afraid of what other people might think. If you're a good friend, bring that up and say, it's okay, it's good for you, go ahead and do it. It's not a big deal. It's more important to have your diabetes under control than worrying about somebody seeing you taking a shot. So be supportive of those around you, because I'm sure you know somebody with diabetes that you live with or lives next to you, or it's a friend of yours. Then get involved in the research, get involved in advocacy that is being done with American Diabetes Association or Juvenile Diabetes Foundation. These are wonderful organizations that help our patients and help the research, help the science. So get involved, make a difference.
That sounds great. And can anybody, this question came up in our last chat, so I'm going to ask you, people were wondering if they could support your work through donations. I mean, can people donate? Whether the clinical trials, they can obviously enroll, whether they're healthy or ill, but can they also give you a monetary?
So if they want to, yes or no, yes. We like to be supported. That's being done through the office, our university office, right? For donations.
Development, I think.
Yes. So. That's the proper venue to do any donations, and if they're marked for diabetes research or for a certain cause, then they're being directed in the right place for that kind of research.
Let's see, we got more people liking our conversation.
Wonderful.
So where do you think there's more? It looks like they're more about research. Where do you think more of the focus is on? Do you see it moving more toward being a type 1 diabetes or type 2 diabetes, or is it pretty equal?
So type 2 diabetes is obviously a lot more common. Like I said, 1 in 10 patients have diabetes, of which 95% have type 2 diabetes. When it comes to research, we obviously want to invest in all types of diabetes because it's not an easy disease for neither type 1 or type 2, and we want to make our patients' life easier regardless of which type of diabetes they have. So there's quite a bit of research going on at both fronts. Probably a little bit more in type 2 diabetes because we have more patients and more new drugs that are being developed. So I think there are more projects to be involved with in type 2 diabetes. But we don't want to forget our patients with type 1 and their daily struggles, and we have quite a bit of research ongoing at the national level towards that closing that loop, we call it. So making that independent system that can control the blood sugar. There's quite a bit of research in that direction. There's quite a bit of research in preventing type 1 diabetes. It's through the TrialNet system that we have, and we have quite a bit of research when it comes to complications of diabetes and how to prevent them, and we treat them, and those apply both to type 1 and type 2 diabetes.
So it looks like James is wondering, and this is a specific question, he's wondering are there any natural foods that lower blood sugar? So
there are some spices that lower blood sugar. To name the one that's most commonly cited, it's the cinnamon.
Cinnamon?
But we're talking about a large amount of cinnamon that you would have to take day in, day out to see a relatively small change in blood sugar. So it's probably, think about diabetes, it's a lifelong disease. It's something that you're gonna have to address for pretty much the rest of the life. So you need to, whatever changes in your diet you make, they need to be sustainable, not just for a week or 2 or a month, but forever. Eating 10 grams of cinnamon every day, I don't think anybody really can make that part of their daily routine.
So how much cinnamon would that be?
That would be several tablespoons. Yes.
Yeah.
That's quite a bit of cinnamon.
That is a lot of cinnamon.
Even for somebody who likes cinnamon.
Yes.
And like I said, it helps a little bit, but it's unlikely that it's gonna keep the disease at bay or be sufficient for control of the diabetes,
Okay.
especially if it's a more advanced form of diabetes.
Okay. So we've got cinnamon, and maybe the rest of it, for the rest of your diet, just eat a variety of foods.
Yes, and it's a variety of foods. Stay away. The main things that I tell my patients, I have a bad list that I give them, and that's pasta, rice, potatoes, and certain beans, not the green beans, but the regular beans.
Okay.
Those are very high in carbohydrates. And again, I'm not saying never touch these, but the serving size of these should be very, very small.
Right.
So like for rice, I'd say half a cup to a cup, it's more than enough in a day.
Okay.
So, we're used to going to a restaurant and when we get a pile of rice or a pile of potatoes, that's probably 5 to 10 serving sizes that we're eating.
Okay.
So we should stick to one serving size of these less favorable foods that affect diabetes quite a bit.
So since half a cup to a cup is, as you said, a fraction of what you get when you go out, or even sometimes when you serve yourself at home, what are there foods that we could replace that with that are maybe just as filling or just as enjoyable?
Absolutely. And I say things like green beans are healthy and much lower in calories. The cauliflower, broccoli, bell peppers, carrots, all of these can be cooked in various ways or eaten naturally without the dip, because the dip is very high in calories. Usually all those ranch dressings are very high in calories, but either fresh or cooked, any of these lower glycemic index vegetables are very healthy, and you can have a larger amount of them without increasing the blood sugar.
Okay. So there are any specific ways that it's good to cook them? Obviously, you don't want to fry them, it sounds like.
Yes, you don't want to fry them. Other than that, just whatever way you like. I like mine fresh, so I like to eat my carrots fresh, my celery fresh. But if that doesn't work for you, just cook it whatever way it's flavorful and tasty to you. It's still better than eating fried foods or a lot of rice or potatoes. So any way you like it.
And do you have the same advice for parents that are maybe cooking it for children, trying to get them to eat more, particularly children that may be on the heavy side?
I think that's an even bigger challenge, because I know my kids won't eat any of that stuff.
Yeah.
So that is challenging with the kids. So preparing the food where it looks good, it's obviously more important for kids. You can attract them with some colorful foods and arrangements on the table and mixing them in fun ways that might be attractive. And you know your kids best, how to get them to eat the healthy stuff and what would it take. I think it's well worth the effort to encourage them to eat the healthy foods, because their taste buds get used to eating a certain way, and they will carry that into adulthood, and they will to some degree determine what they're gonna eat as adults. So it's good to provide a good example and encourage them to eat the right things now, and then they're gonna do the same thing to their kids.
Yeah, hopefully. So we are wrapping up. We've only got about a minute and a half left. I wanted to thank everybody for tuning in and joining, and to feel free. We've got about a minute if you want to ask any more questions. I do want to thank again Parkland and the American Diabetes Association North Texas chapter for helping us promote this and put it out. And I guess last question for Dr. Lingve, is there any kind of parting message you'd like to leave about diabetes and the community, about the work we're doing here?
Absolutely, yes. Diabetes is no longer a death sentence. It used to be. So patients with diabetes can live a very full life, active life, and long life, as long as they take good care of themselves. So it's well worth investing into learning how to deal with the diabetes, how to make it work. Invest into monitoring your blood sugar and making sure that they're in normal range. Work with your doctor to get the right treatment, because that will prevent all the bad complications that are associated with diabetes. And it's very well worth the investment, because then you can accomplish anything you want in life and live a normal, healthy, long life.
Awesome. Well, thank you very much,
Thank you.
Dr. Lingve, and thank you guys for tuning in, and have a wonderful day.
Bye-bye.